Have you ever felt the fear and uncertainty that comes with kidney disease? You're not alone. Many people used to think kidney disease always gets worse and can't be stopped, but science disagrees. Welcome to a groundbreaking guide that will revolutionize the way you think about kidney health. Imagine a world where no kidney patient ever has to face the prospect of losing a kidney again. Sounds incredible, right? Well, it's not just a dream. Recent scientific breakthroughs have brought us to the brink of a revolution in kidney health. We're talking about a groundbreaking study involving over 400 participants spanning an incredible 8 years, unveiling secrets that we never knew. And the most exciting part? I'm going to reveal how even those in the advanced stages of kidney disease, yes, stages 4 and 5, can reclaim their health. You're about to discover the 10 transformative steps that are empowering kidney patients to take control and rewrite their stories. This journey isn't just about acquiring knowledge, it's about empowerment. By arming yourself with the insights and strategies shared in this guide, you'll possess the tools to take control of your kidney health and make informed decisions that will impact your well-being for years to come. Step 1. Take control of oxalates. Eating lots of fruits and veggies is good for our kidneys, but sometimes it can be confusing what's good and what's not. Some foods, like spinach and nuts, have something called oxalates. Oxalates are natural compounds found in many plant-based foods. These compounds can stick together and form crystals in your kidneys if you have too much of them. But don't worry, because you don't have to say no to these foods completely. It's about finding balance. You can manage oxalates in 2 ways. First, some foods, like those with lots of calcium, can help keep oxalates in check. Calcium tends to bind with oxalates, making it easier for them to pass through the kidneys, reducing their chances of forming stones. Second, boiling veggies can help lower oxalate levels, so eating boiled veggies can lower the chances of getting kidney stones. Fiber, which is mostly found in fruits and veggies, can also help keep oxalate levels in check. Fiber has a tendency to bind with oxalates in the gut, preventing them from absorbing and getting into the bloodstream. Low oxalate levels in the bloodstream mean lesser chances of developing oxalate stones. Incorporate calcium-rich foods like dairy or fortified plant-based milk into your meals. One of my patients, who had recurrent kidney stones, found significant relief by adding a glass of milk to his daily diet and ensuring his vegetables were boiled. His stone formation decreased remarkably. In my practice, I've seen the positive effects of managing oxalates firsthand. A middle-aged woman with a history of kidney stones began incorporating more calcium-rich foods and boiling her vegetables. Over time, her kidney stone incidence reduced significantly, showing the power of dietary adjustments. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Step 2. Get rid of uremic toxins. Okay, listen up. Here's another trick to help your kidneys out. Have you ever heard of uremic toxins? Uremic toxins are certain waste products and harmful compounds that can build up in the blood, especially when the kidneys are unable to effectively filter and excrete them from the body. These toxins can form due to the breakdown of proteins, the metabolism of amino acids, and other metabolic processes that can increase the levels of creatinine, urea, and nitrogen-based compounds in your body, particularly when your kidneys aren't healthy enough to excrete them out of your body. The fiber in your food, particularly soluble fiber, binds with water and forms a gel-like substance in your gut. This gel can bind to waste products, including uremic toxins, and prevent them from getting into your bloodstream. One very rich source of soluble fiber is acacia fiber, also known as acacia gum or gum arabic. It is derived from the sap of the Acacia senegal tree. Acacia gum typically contains a high percentage of soluble fiber, roughly 85 to 95% of its weight. Surprisingly, some studies show that people with serious kidney problems can even avoid dialysis for up to 8 years with its help. One of my patients, who was on the verge of needing dialysis, started incorporating acacia fiber into his diet. He mixed a tablespoon of acacia powder into his water twice daily. After a few months, his toxin levels dropped, and his overall kidney function improved. In my years of practice, I've seen the benefits of soluble fiber, like acacia gum, in managing uremic toxins. A patient with advanced kidney disease significantly delayed the need for dialysis by adding acacia fiber to his diet. This simple addition made a huge difference in his health and quality of life. Step 3. Hydration habits. Water is the elixir of life, flowing through your body like a river, cleansing your kidneys of toxins and ensuring they function at their peak. But why is hydration so crucial for kidney health? And how can we ensure we're getting enough of the good stuff? Adequate hydration keeps your blood volume stable, allowing your kidneys to effectively filter waste products and maintain electrolyte balance. Without enough water, your kidneys are forced to work overtime, leading to a host of potential problems from kidney stones to urinary tract infections. How much water should you be drinking to keep your kidneys happy and hydrated? While the adage of 8 glasses a day is a good starting point, your individual hydration needs may vary depending on factors such as age, activity level, and climate. One of my patients, a physically active young man, needed to increase his water intake to 12 glasses a day to maintain optimal hydration. I've seen countless patients benefit from simply increasing their water intake. One memorable case involved a woman with chronic kidney infections. By ensuring she drank at least 8 glasses of water daily, her infection rates dropped significantly and her overall kidney health improved. Step 4. Increase vitamin D intake. You might wonder, how can one vitamin make a big difference? Well, studies show that about 80% of people with kidney issues need more vitamin D. Not just that, a deficiency in vitamin D has been linked to the development of kidney disease, making it a key nutrient to focus on. Having enough vitamin D levels can help you regulate your blood pressure, support your bone health, and even help lower your creatinine levels. Moreover, proteinuria is a condition when there is too much protein in the urine and is often a sign of kidney damage. Luckily, vitamin D has also been shown to prevent this condition, helping to protect your kidneys from further harm. There's a test called the 25-hydroxy vitamin D test. If its rating is below 30 nung per milliliter, experts say it's not so great. One of my patients had a deficiency and began taking 2,000 international units of vitamin D daily, with a bit of vitamin K2 and magnesium. After a few months, her vitamin D levels normalized, and her kidney function tests showed significant improvement. In my practice, I've seen the transformative effects of vitamin D supplementation. One patient, a man in his 50s with stage 3 kidney disease, saw a reduction in proteinuria and improved overall kidney function after starting a vitamin D supplement regimen. Step 5. Regular exercise routine. Exercise is the key to unlocking a world of health and vitality, strengthening your body from the inside out and fortifying your kidneys against harm. But why is regular exercise so important for kidney health, and how can we incorporate physical activity into our daily lives? Exercise improves blood flow throughout your body, including to your kidneys, helping to flush out toxins and waste products more efficiently. Additionally, regular physical activity can help control blood pressure, reduce the risk of diabetes, and maintain a healthy weight, all factors that play a crucial role in kidney health. What does a kidney-friendly exercise routine look like? It's all about finding activities that get your heart pumping and your muscles moving without putting undue strain on your kidneys. From brisk walks in the park to invigorating swims in the pool, there are countless ways to get your daily dose of exercise and support your kidney goals. One of my patients started with daily 30-minute walks and gradually incorporated lightweight training, which significantly improved her kidney function and overall health. I've seen numerous patients benefit from regular exercise. One patient, a woman in her late 40s with high blood pressure and early-stage kidney disease, began a routine of swimming 3 times a week. Over several months, her blood pressure stabilized, and her kidney function tests showed marked improvement. Step 6. Monitoring blood pressure and blood sugar levels. These vital signs are the barometers of your body's internal harmony, providing valuable insights into the health of your kidneys and overall well-being. High blood pressure and uncontrolled blood sugar can wreak havoc on your kidneys, damaging the delicate blood vessels and tissues responsible for filtration and waste removal. Left unchecked, these silent saboteurs can pave the way for kidney disease and other serious health complications. How can we ensure our blood pressure and blood sugar levels stay within the healthy range? It all starts with regular monitoring and proactive management. Investing in a home blood pressure monitor and blood glucose meter allows you to track these vital metrics at your convenience, empowering you to take control of your health and make informed decisions. One of my patients with diabetes began monitoring her blood sugar levels more frequently, which helped her make necessary dietary adjustments and improved her kidney function over time. In my practice, I've witnessed the benefits of regular monitoring of blood pressure and blood sugar. A patient with diabetes and hypertension began using home monitoring devices, which allowed him to adjust his lifestyle and medications more effectively. As a result, his kidney function improved significantly, highlighting the importance of vigilant self-monitoring. Step 7. Managing stress levels. Stress is the insidious villain, silently gnawing away at your well-being and wreaking havoc on your body and mind. Chronic stress triggers a cascade of physiological responses in your body, including the release of stress hormones like cortisol and adrenaline. Over time, these hormones can take a toll on your kidneys, raising blood pressure, disrupting blood sugar levels, and compromising immune function, all factors that contribute to kidney damage. How can we manage stress effectively and protect our kidneys from harm? It all starts with self-awareness and adopting healthy coping mechanisms to navigate life's inevitable ups and downs. From mindfulness meditation and deep breathing exercises to yoga and Tai Chi, there are countless ways to soothe your soul and restore balance to your body and mind. One of my patients, who struggled with chronic stress and high blood pressure, found significant relief through daily meditation practices, which also benefited her kidney health. In my years of practice, I've seen the profound impact of stress management on kidney health. One patient, a man in his 60s with chronic kidney disease, began practicing yoga and deep breathing exercises. Over time, his blood pressure stabilized and his kidney function tests showed positive changes, demonstrating the power of stress reduction techniques. Step 8. Getting adequate sleep. Sleep is the ultimate reset button for your body and mind, allowing you to recharge and rejuvenate after a long day's journey. Why is sleep so crucial for kidney health? During sleep, your body undergoes a process of detoxification, flushing out toxins and waste products that can accumulate in your kidneys and other organs. Sleep also plays a vital role in regulating hormone levels, repairing tissues, and promoting overall well-being. How can we ensure we're getting enough quality shut-eye? It starts with cultivating healthy sleep habits and creating a soothing bedtime routine. From setting a consistent sleep schedule to creating a calming sleep environment free from distractions, there are plenty of steps you can take to optimize your sleep quality and quantity. One of my patients, who had chronic insomnia and worsening kidney function, improved her sleep hygiene and noticed significant improvements in her overall health and kidney function. I've seen the benefits of adequate sleep on kidney health in my practice. One patient, a woman in her late 50s with chronic kidney disease, struggled with poor sleep quality. By implementing a consistent bedtime routine and reducing screen time before bed, she experienced better sleep and improved kidney function over time. Step 9. Identifying and addressing the root cause. When it comes to protecting your kidneys, it's crucial to tackle the underlying issues head-on. Nearly half of the individuals with kidney problems also struggle with diabetes. Yes, diabetes is a leading cause of kidney disease. Many people with type 2 diabetes believe that if they've had the condition for over 6 years, there's no way to reverse it. However, recent studies have brought some good news. They reveal that even if you've been living with type 2 diabetes for as long as 11 years, there's still a chance to turn things around. A natural approach to combat diabetes starts with your diet. Recent research has shown that simply changing what you eat can put diabetes into reverse. A natural remedy that's gaining attention in the fight against type 2 diabetes is apple cider vinegar, ACV. Integrating ACV into your routine is simple. Just mix 1 to 2 tablespoons of unfiltered ACV in a glass of water and drink it before meals 2 to 3 times a day. This concoction can help lower blood sugar levels and improve insulin sensitivity. I've seen the transformative effects of dietary changes in managing diabetes and improving kidney health. One patient, a man with type 2 diabetes and early-stage kidney disease, began incorporating ACV into his diet. Over time, his blood sugar levels improved and his kidney function stabilized, highlighting the power of natural remedies and dietary adjustments. Step 10. Make simple dietary adjustments. Alongside the advice I've shared in the first 4 steps, a few straightforward tweaks to your diet can significantly aid in your recovery from kidney disease. Firstly, it's important to cut down on sodium salts to manage blood pressure and fluid retention. This means steering clear of processed and packaged foods notorious for their high sodium content. Depending on your kidney disease stage, you might also need to watch your protein intake. Consuming high amounts of protein can burden the kidneys, particularly if you're already dealing with kidney stones or chronic kidney disease. It's a good idea to consult a healthcare professional to determine a safe level of protein consumption for you. Potassium is generally beneficial for people with healthy kidneys, and even those in the early stages of kidney disease. However, if you're in an advanced stage, your kidneys might struggle to regulate potassium levels. In such cases, limiting high potassium foods like bananas, oranges, tomatoes, and potatoes becomes essential. Refined carbs, such as white bread, white rice, and pasta, should be avoided. Instead, opt for complex carbohydrates like whole grains, fruits, and vegetables. Among these, certain fruits stand out for their kidney-friendly properties. These include apples, berries, grapes, pineapple, and watermelon. In my practice, I've guided many patients through simple dietary adjustments that have made a significant impact on their kidney health. One patient, a woman in her 60s with stage 4 kidney disease, followed a low-sodium, low-protein diet and saw remarkable improvements in her kidney function. These dietary changes, along with regular monitoring and professional guidance, can make a world of difference. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. By following these 10 transformative steps, you can take control of your kidney health and potentially prevent the loss of a kidney. Each step, from managing oxalate intake and increasing hydration to monitoring vital signs and making dietary adjustments, contributes to a holistic approach to kidney care. Remember, it's not just about making changes. It's about making informed and empowered choices that will benefit your health for years to come.